Hi everyone, and today we have here Dr. Srikanth, who got NEET PG 2023 550 marks out of 800 with AIR 8251, and now he is doing MD Dermatology in MGIMS Government Medical College. And firstly, I really congratulate you, Dr. Srikanth, for getting your dream branch dermatology, and I welcome you to Dr. JTM's YouTube channel.
Thanks a lot, sir. Thanks a lot. It's really pleasure to have your interaction with you, sir. Thank you.
So I just wanted to interact with you regarding your NEET PG journey. No, I wanted to ask, like everyone wants to know only the success stories of the toppers, like only they wanted to know how they succeeded in life. But I wanted to know your failures also, because you are one student who got 78,000 rank in NEET PG 2022, and you have given two attempts in INICET May 2022 and November 2022, but not qualified, and eventually it turned out to be NEET PG 2023 8,000 rank. Tremendous comeback. So what are your setbacks? How did you face those three failures?
Yes, sir. Sir, in last year, in 2022, I finished my internship attempt. In internship attempt, sir, I didn't study too much. I gave that attempt as a free attempt only. Last 2 months, I studied somewhat little. I got all India rank of 78,000. But that gave me a major setback because in all the MBBS years, I studied so well. So I am expecting rank below 20 or 15K. So the rank of 78,000 out of 1.8 lakhs, that's really a major setback. Really, I'm not getting to know that what is really wanted in NEET PG exam. The syllabus is so vast. I'm even feeling that rapid revision videos are so big. That much setback I got. Then in May INICET I didn't qualify. After 4 to 5 months after May INICET, November INICET came. November INICET I studied for at least 2 to 3 months prior to that really well. Still I didn't even qualify. NEET PG 2023 came, and last 1.5 months I studied like crazy, and finally got 550 marks. From last Maro GT I got only 381 marks, sir. Out 115 correct to 151 corrects in last NEET PG. That gave me so much strength, and finally I got marks 550 out of 800 and all India rank of 8,000.
What really you have learned from those three failures? Like what have you changed?
Sir, actually after getting rank of 78,000, everyone judged me basically, because the one guy who studied so well in final year and third year and second year got distinction in 3 subjects. How that guy rank got 78,000? And I'm constantly in touch with motivators like you, Dr. Rohan Khandelwal sir, Dr. Zaina Vora ma'am, Dr. Nikita Nanwani ma'am, and Rohan Khandel and Deepak Marwas. I'm watching all the videos, motivation, and these things. And after getting that rank, I basically confused what to study, where to start. In every GT I'm getting top lower 3 subjects different. Like in first GT I got forensic medicine, ophthalm, and medicine in bottom 3, and in next that 3 went to the top and other 3 went to the bottom. So I'm getting really confused. So in November also, after didn't qualify in November INICET, I analyzed what I'm doing wrong. So then I started to giving GT more seriously. I'm giving GTs in my room, that is very comfortable. Then I went to the library and giving GT for every 10 days and analyzing every questions like this is a final exam. Out of 200, even if I'm getting 110 corrects, I'm thinking that positively, that 90 to 120 questions I improved from last year. So I analyze every question, every sentence, that what will examiner think, what will examiners want to ask. Revise only rapid revision, because there is no time for studying whole syllabus. So I revise only rapid revision. And even in rapid revision, I do highlighted points which previous year questions were there. Pediatric interception is really important. So I studied interception only from one subject, that is from pediatric. I didn't study from radiology interception, what are the findings, diagnostic points, and from surgery. Only one subject, and from all these points, what previous year questions can ask.
So see, one thing here is like mostly 80 to 90% of the students will be in the same phase that you are in. Yes. When you have got 78,000 rank. So from there they try to do different things, really don't work out, and they'll definitely feel bad about it. But you coming up with new strategies or whatever you're building, like mainly analyzing your mistakes and all, is really a good point that every aspirant should learn. Not doing well in the main exams like INICET, when we talk about that particular point, What made you try and not give up?
Truly speaking, I had a major setback after November INICET. And after that, one major family health issues were there with me. I should take such a branch and such a doctor that my family members would be really proud of me. And there is one video of Praveen Tripathi sir of Prepladder. They showed the how to power of imagination. So in the morning, I used to close my eyes and think that the day of result is there. I got rank this and good clinical branch in government medical college. What is that feeling? So that is adrenaline rush for morning. So that is some little things I accumulated, thinking positively, and I think that major issue with me was I am not attempting more than 180 questions. Then I got only 115 correct. Then after January, I attempted 195 questions also, 196 questions also, and what I find, sir, after attempting each unknown question, I am seeing that what is the logic behind that attempt and what is the mechanism of thinking that you require for that questions. So out of 16 questions, I didn't know even if I attempt that 16 questions, 5 were correct. So that is also good thing. And in final exams, I attempted 199 questions. Out of that, I got correct 151 questions and 49 wrongs. So that is my total strategy, that I will attempt more than 195 questions and maximum 200 questions, not less than 195 questions.
That's really a positive attitude, because most of the people think that they have to play safe. Like they only
Yes.
answer whatever they know, even 50% chance questions they will be definitely skipping. So
Yes, sir.
this attitude is really good, right? So everyone will ask definitely, how many MCQs did you do to get this rank? How many grant tests did you do overall during your preparation? So did the grant test really help you, or doing MCQs will only help you, or studying the notes itself will help you? So what is your take on this?
I firstly focus on previous year questions because that is the questions they are repeating. It means like some like ABG and vitamins, and these are some topics because they will definitely come in final exam. Porphyria, they will definitely come in final exams. In the year, I think total 11 questions are from vitamins, and in previous year every exam has one vitamin question. So after doing that single topic of vitamins, I got 11 questions correct from biochemistry. So revised only that 200 previous year QBank modules. That is I revised twice. And even in that, I revised the one question which are bookmarked.
Okay, so with regards to grant test, what do you suggest people to go forward?
Sir, initial after the internship attempt, I gave grant test once a month. But after November INICET, I gave grant test 15 days. 15 days. After 15 days means 2 in a month. And my major suggestion to the fellow aspirants is that do not give a grant in last 15 days, because even if you score bad in that test, then total confidence will go down. So that mistake I made in last year internship attempt, that I gave GTs just 4 days before the final exam. So my fellow aspirants should really learn that not giving a single grant test in last 15 days, sir. That is my suggestion.
That's very good point, because as you have said right from the point where no, we have to analyze your mistakes, then learn from it, and then see what are the topics that are being repeatedly asked, and keep on revising them instead of going for new topics, right? And yeah, you were saying about some family health issue that have happened. I know
Yes, sir.
personally you have told me what have happened, but I wanted to know, no, that's like a mental breakdown to anyone.
Yes.
No one could really handle it. And how did you, build up that strong mental health during that particular time where you had this serious family health issue?
Sir, the day of November INICET result and day of that family health issue report, medical report, that day is same, sir. That day is really means one of the worst day of my life. That day I decided this is my worst day, and it's in my hands to make the best possible day in next 4 months. So I decided that I'm now in life's worst phase and lowest phase. So in next 4 months, next 3.5 months is in my hand, and I will make the result day one of the best day of my life. So I dedicatedly studying in last 2.5 to 3 months, sir.
No, I would really wanted to appreciate at this particular point of time, because nobody wants to think about future from that particular incident that have happened. I would really say you have opted for greatness to come to your way instead of just sitting
Yes.
there and stopping time. The preparation is not only a phase that will happen for you during this entire 90 days or 100 days. A lot of things will come, like family health issue or economic issues or your health issue. Anything can happen, and I think that shouldn't stop you from what you wanted as in the process of achieving something. And one final small point, I just wanted you to
Yes.
put up mental health and this PG preparation stress that aspirants go through.
Yes. Okay, so I want to tell fellow aspirants that even if you at lowest point of your life, just think one simple point that NEET PG exam is not fatal exam, because even if you score bad in this exam, there is next attempt. Even every successful doctors, no one will ask when you graduated in your UG also and in PG also. So even if this year we got rank of 2 lakhs also, next year you can score 2000 rank also, 20,000 rank also. No one will ask you when you graduated, when you got admission, how many repeats you have done. So think about that. And I personally advise people that take 2 to 3 branches in mind, because even if we didn't got one branch, then we, yes, definitely one branch is there in our mind. Even if we didn't get that one branch, second branch should be also there, because in cases like one branch, problem is that if we didn't get that branch, we mentally break down in that attempt, and then we
Exactly.
hope even after good rank we got repeat also, and then next year also same rank. So getting 2 or 3 branches in mind is also very good. And I personally advise one thing that Praveen Tripathi sir told in his seminar, that what we have to give the next 110 days, 10 to 12 hours per day. That what we have to give, that 10 to 12 hours per day, and what we will learn, that glorified MDMS degree in government medical college. That is the quote I written in my room. I personally advise people that go ahead with this 110 days, maximum utilize your time. Put some posters, like motivated posters. And sir, I also want to tell one thing. Your video came just 30 days before the examination, that this is the exam. Your video is like, I sent that video to all my fellow batchmates, that this is the video you should watch. That video you told one thing. 30 days, forget everything. Forget everything and just focus on this last exam. After 30 days, no one will ask you what you did, what you studied, what you not studied. So I watched that video also. And comeback is always greater than setback. That is what I want to tell my fellow.
Yes, that's really great, and I'm really happy to have a good positive interaction with you, Srikanth. Maybe we could again sit and talk more and more about your branch and my branch, and so that people who are also residents will get enlightened about the branches and the colleges. And I'm really happy to talk to you.
Thank you so much, sir.
Thank you. Bye bye. So that's the interaction that we had with Dr. Srikanth, who is a PG aspirant last year, who have had a lot of setbacks, but he have given a strong comeback with a good air of 8,150. I really congratulate him, and all my best wishes to him and for his future. It's good to hear from those people who have got ranks between 3,000 to 10,000 instead of from the toppers like first rank or second rank. Those people will always have a stipulated individual mentality, but most of 80% of the aspirants will be having the mentality of those people who got ranks between 3,000 to 10,000. So whatever fruitful information that you have got from this information, please do share with your fellow aspirants, and let them also know the positives and negatives of having a good and bad preparation. So that's it for today, and we'll come back with one more video of this kind if you liked it. And don't forget to like, share, and subscribe, and I'll be back again. Thank you so much.